that is shock index. What is shock index? It is a quick bedside measurement which is used to assess how well a patient is blood, circulating blood, especially in cases of shock, trauma, and bleeding. Okay, what is shock index? It is a quick bedside measurement which is used to assess how well a patient is circulating blood, especially in the cases of shock, trauma, and bleeding. Now, it has a special formula which is a ratio between heart rate and systolic blood pressure. We can assess the circulation of blood in a patient by the simple ratio which is the heart rate divided by systolic blood pressure. Okay, now let's discuss what are the clinical uses of shock index. How we can use it clinically. So the first thing that it does is that it detects the hypovolemia. We can detect hypovolemia in the body through this shock index. It detects hemorrhage or sepsis. Okay, sepsis, hemorrhage, and hypovolemia are life-threatening complications. So the shock index is a simple ratio. If we do it at the bedside of a patient, we can detect the hypovolemia, hemorrhage, and sepsis early and manage accordingly. It also used for trauma assessment, and it also used for monitoring the response to treatment. Let's suppose if we have a patient with trauma and we are doing the shock index at bedside continuously after the infusion of fluids and blood products, etc. So through this shock index ratio, we can monitor the response to treatment. For example, IV fluids and blood products, etc. Okay, so these are the most important clinical uses of the shock index. It detects hypovolemia, hemorrhage, sepsis, trauma assessment, and it also helps in the monitoring response to treatment, that is IV fluid and blood, etc. Ranges between 0.5 to 0.7. Now, if the value decrease or increase, it gives us major interpretation. If the shock index value is greater than 0.9, then it suggests early shock. Okay, if the value is greater than 0.9, then it shows early shock even if the blood pressure is normal. Okay, if the shock index is greater than or equal to 1.0, then it is a strong indicator of significant circulatory compromise, and it is associated with increased risk of mortality and it need for transfusion and ICU level intervention. Okay, if the shock index value is greater than 1, then what is it? It is a strong indicator of significant circulatory compromise. Okay, and it is associated with high risk of mortality. Now you can see that this is a very simple ratio, but it is interpreting here mortality. So if it is the value is greater than 1.0, then it is a strong indicator for circulatory compromise and mortality. And what is needed at this point? It needs transfusion and ICU level care. Okay, if the shock index value is less than 0.5, then it shows bradycardia. It is not typically a concern of on its own. The major shock index values which interpret mortality and circulatory compromise are 0.9, which detects early shock, and if it is greater than 1.0, then it indicates significant circulatory compromise and the increased risk of mortality, and the transfusion is required at this point, and ICU level care is required at this point. Let's discuss why shock index is important in PPH and what is its importance in pregnancy. So the BP can stay normal for a long time in OBS patients because of the physiological changes. The BP usually doesn't rise in the OBS patient and it does not detect the early or hidden ongoing bleeding in patient. Okay, so the shock index is the ratio which early detects the hidden or ongoing bleeding. Okay, shock index rises earlier, then BP falls. It means that the shock index is more stronger detection early than BP falls in pregnancy. Okay, that's why shock index is very important in PPH, because the shock index rises earlier, then BP falls, and it gives us early detection of the hidden or ongoing bleeding. That's why. Now, what are the normal values of shock index in pregnancy? Normally, the shock index value is 0.9, which is okay in pregnancy. It is slightly higher than the non-pregnant, but usually it is less than or equal to 0.9. If the shock index is greater than 1, then it is a strong predictor of significant blood loss in pregnancy in PPH, and it needs urgent intervention and ICU care. Also, if it is greater than 1.4, then it is strongly associated with PPH and massive transfusion is required because it shows the increased risk of mortality or morbidity. Okay, so the value 0.9 equal to 0.9 or less than 0.9 is usually fine in the pregnancy. If it raised than 1, then the blood loss, it requires the urgent intervention and ICU care. And if it is greater than 1.4, then It is associated with severe PPH and massive transfusion is required, and it usually shows us the increased morbidity and mortality risk. Okay, now let's discuss the modified shock index value. What is modified shock index? It is an adjustment of the traditional shock index that uses mean arterial pressure instead of systolic blood pressure. It is often considered more sensitive for detecting early shock, including in OBS patient. Okay, modified shock index value is especially for the OBS patient, and it is used for the early detection of shock in the OBS patient. Now, what is the formula for modified shock index? It is heart rate divided by mean arterial pressure. Instead of the systolic blood pressure, here we will be using mean arterial pressure. Now, how we can find out the mean arterial pressure? The formula for it is systolic blood pressure plus 2 multiplied by diastolic blood pressure divided by 3. Okay. For modified shock index, we will be using the mean arterial pressure, and to find out the mean arterial pressure, we will be using the systolic blood pressure plus 2 multiplied by diastolic blood pressure divided by 3. Okay. Now, what are the normal values for this modified shock index? So, the normal value ranges from 0.7 to 1.3. Value is from 0.7 to 1.3. Now, if the modified shock index value is greater than 1.3, then it indicates the high risk of hemodynamic instability and shock. Instability and shock, okay? If the value is greater than 1.3. If modified shock index value is greater than or equal to 1.7, then it is a strong predictor of severe shock, and it requires ICU admission, and it shows the increased risk of mortality. Okay, if the value is greater than 1.7, then it detects a strong shock and it requires ICU admission and increased risk of mortality. Now, why modified shock index may be better than the simple shock index? So, the mean arterial pressure that we are using in this modified shock index, it reflects perfusion pressure more accurately than systolic BP. Okay, it gives accurate reading of perfusion pressure than simple BP. Also, modified shock index can identify occult shock earlier in trauma, sepsis, and also in OBS emergencies like PPH, etc. Okay, so the most accurate thing that can give us the best results or early detection of the emergencies is modified shock index. Then on the second number is the shock index, and on the last number is the simple blood pressure. Okay, so let's take a quick example of modified shock index. So let's suppose for finding out modified shock index, we are having a formula of heart rate divided by mean arterial pressure, and for mean arterial pressure, we are having a formula of systolic blood pressure plus 2 multiplied by diastolic blood pressure divided by 3. So if we are having a systolic blood pressure of 120, or let's suppose 100, and diastolic blood pressure of 80 or 60, and heart rate of 120 beats per minute. So first let's find out the mean arterial pressure. The systolic blood pressure is 100 plus 2 multiplied by the diastolic blood pressure is 60, and it is divided by 3. So we are having a value of 73. Now, for a modified shock index, we will divide the heart rate, that is 120 divided by 73, and the value we are having is 1.64. So the value is greater than or equal to 1.7, or it is greater than 1.3. The value is greater than 1.3. So it indicates the risk of hemodynamic instability and shock. In this way, we can find out the early detection of emergencies in obstructed from modified shock index, especially in the case of PPH or trauma or any other emergency. Thanks for watching.